All right. So welcome, everyone. Thank you for joining us for our webinar, Solutions for Common Compliance Challenges in Physical Therapy. My name is Kelly Brown. I'm a PT and Director of Business Development and Clinical Projects at Prediction Health. I'd like to introduce our guests today. We have Ravi Atreya and Daniel Hirsch. Ravi is a dual MD, PhD, and co-founder, CMO, and compliance officer at Prediction Health. And Daniel is a PT compliance officer and the creator of the PT Pocket Coder app. If you'd like to pin the speaker on your screen, you can select view at the top right corner and then select speaker. That'll make it easier to view everything during our webinar today. We welcome and encourage questions. Feel free to pop your questions in the chat or private chat to Prediction Health, and we will address as many as we can at the end of the webinar. If there are topics that are not discussed and you'd like to hear about them, go ahead and let us know. All right, we'll go ahead and get started so we can make sure to stay on time here. First, let's go ahead and answer the very basic but complicated question of why does anyone need to maintain compliance in the PT clinic? So is this really required? Why is this important? And how does it directly impact you? So Daniel, I'll go ahead and let you start with that question.
Yeah, thanks, Kelly. And hi, Ravi. Thank you very much for inviting me to join you guys today. Just to preface, anytime we speak about compliance or legal topics, it's obviously necessary to disclose that the following information are simply my opinions in nature. They should not be interpreted as legal advice or individualized compliance services. Okay, out of the way. So if we take a step back and really take a 30,000-foot view of compliance, it really all boils down to risk management, right? So protecting the assets of a business in really a variety of shapes and sizes is ultimately what compliance represents. So it could be moral, it could be ethics, decision-making, of course, but they impact risks. So however, maintaining compliance in your clinic it's really the right thing to do. And oh, by the way, if you don't believe me, just look online at the Department of Justice's website and you'll see a running list, terrible list of fraud cases. And guess who keeps making this list? Sadly, physical therapists. I don't know why. We keep making the list. So let me give you the Cliff Notes version of regulatory details that really impact therapy compliance. So we have federal standards such as like HIPAA, privacy, security. We also have state statutes and laws. We also have professional standards, right? So such as the APTA guide for professional conduct, and there's other forms as well. And even if you're not a member, Kelly, of the APTA, for some reason, did you know that you're actually still required to maintain those standards, which is pretty interesting.
Oh, that is interesting.
So like, your State Practice Act, there's another location where as a licensed healthcare provider, that's another reference for material where it really directly impacts your compliance and your operations. And again, we want to stay compliant because it's the right thing to do. But in addition, it avoids costly penalties, license disciplinary action, and even jail time.
So how do you stay compliant nowadays, Daniel?
So how do you actually do that, right? That's the question. So you need a resource to guide you. That's the bottom line. You could do it yourself, possibly, but unless you have the time to review all the regulatory updates, maintain policies, even assess like security IT updates or investigations, audits, on and on and on. If you don't have an experienced compliance officer available to you in your organization, you got to find one. Even if you're like a small organization nowadays, you could still even get like a custom compliance program through companies like Meg Academy, right? There's no reason why you shouldn't have one. I want to hit home the point that ignoring compliance is like kind of buying a house and thinking property insurance is just like a waste of resources. Like, why wouldn't you protect your investment? So one major component of having a compliance program is documentation. I know how popular that sounds. And yes, it's actually required to justify the skilled care that was provided for every single visit, every single note. We really need to be constantly asking ourselves, was the treatment reasonable? Was it appropriate? And of course, medically necessary. Kelly, I was wondering, from an operations standpoint, what has really been the main struggle that you find that therapists have with really understanding what's involved with the basic standards of documentation?
Right. That's a good question. So to give the group some of my background, I've spent years as a clinical director and a regional director. So I did a lot of work trying to bring therapists up to the standards of documentation and compliance that we needed. And the challenges that I always faced was consistency across the board with therapists. So, and that comes from what they learned in school, which typically was too much information, right? It's taking too much time to document and they're over documenting. And then also what they learned from their CIs on their internships and then previous experience with their previous jobs. And then in addition to that, there was, what sort of, how do we have our orientation created? And then what does our onboarding process look like? Like we all know that onboarding is more than just orientation. And so orientation is one day and we have our training for our EMR on one day and our compliance on one day. But then the onboarding and making sure all the therapists are following through with that and maintaining the level of compliance that you train them at is really hard to maintain. There takes a lot of follow-up, there's a lot of follow-through, and then you have to have your leadership to all be at the same level as well. So it was always something that we were running into, and we're always trying to solve the same problems over and over again, whether that be a couple times a year or once a year. We're always trying to solve these same types of problems. So Daniel, what else would be included as part of a comprehensive compliance program beside the documentation portion?
Okay, so that's a big question. I guess as a compliance department, in my opinion, includes, don't laugh, but it would be everyone who works at an organization. It touches everyone because we have an obligation to ensure that fraud, waste, abuse is not occurring. And we do this by providing annual training. It could be role-based training, updating policies and procedures, ensuring that, of course, clear lines of communication are open, as well as also enforcing and responding to issues that impact the company. And of course, my area of specialty is auditing and monitoring. I guess really by now, almost really everyone has an EMR, but I just want to point out that obviously they're not created equal. I'm not going to go promote one over the other. I've worked with many of them, but you should really select a system that's not just revenue cycle friendly, but also that has a really high provider IQ that makes the life of a therapist just easy. And that could be with templates. Internal controls are a great starting point for documentation quality, but maintaining, and of course, I think you know this too, but maintaining that focus over time is really difficult because of staffing changes that occur, technology updates, and things like that.
Yeah, and I can kind of talk about some of the, just the operational challenges that come from, having to do all the internal audits and things like that, right? So, in my experience, we were doing peer-to-peer reviews, and then we had an external person do our, a bigger compliance internal audit. And so the peer-to-peer reviews is time consuming. I don't know any therapist that is super excited to sit down and do that. And then there's a lot of bias and fatigue that comes along with that, right? And then just the time management to try to get that all done. And then when it comes to the information coming at you from any sort of external source, there's a lot of variability in what that means. And I know I would spend hours trying to figure out, what does this particular thing mean and how do I correct it within my documentation or coach my staff to correct it, right? And so I feel like the time commitment and just the amount of resources that we have to put toward this type of thing is draining. And I think that leads to some of the, inconsistencies with maintaining the level that we need to maintain. So Daniel, can you tell us a little bit about the historical audit process, how we've kind of moved through history with it and what's available now?
Yeah, so I won't go long, but even what you just said, I mean, I'm fatigued just thinking about that whole process. Historically, documentation audits and quality assurance workflow, they'd be completed, as you mentioned, through peer-to-peer reviews, and chart audit sampling, 3, 5, maybe 10 charts annually. But just even since last week, in the words of a deputy administrator at CMS, they told me that you can only do so much in this function. There's only so many hours in the day and only a budget of X amount for reviews. So really, in other words, what you alluded to, scaling this function is almost impossible, right? But that's before, I guess, last year that we learned about Prediction Health.
Yeah. So Ravi, I'm going to bring you into this conversation now. So Tell us how Prediction Health is revolutionizing this audit process.
Hi, Kelly. Yeah, that's a great question. So, we started actually digging in with you on clinical documentation in the physical therapy space, and we saw along the way that there were all of these compliance challenges faced in the industry, as y'all have been talking about. And so, what we're able to do is process 100% of the charts that therapists document, as opposed to the small random sampling that would typically occur when a human actually needs to go and read each of the charts. And so our expertise is in processing the unstructured text of the note, in addition to structured data points like billing information. And so we're able to process the free text that the therapist has documented. So for example, like the information that they're documenting in the history of present illness section or the assessment and plan section. And so we're going sentence by sentence with our AI to understand what information is present in that sentence. And so, for example, like understanding if a sentence is talking about past medical history information, signs and symptoms information, they're talking about a goal of care, if they're talking about prior imaging studies or surgical procedures, things along those lines. We kind of put together those categories, working together with therapists and compliance officers, including yourselves. And this helps us quantify the composition of the note. And so we're actually able to look and see what the distribution of content is across a single chart, across an episode of care. And then we're actually able to look on a population level across different patient cohorts, different providers, across an entire practice or practices. And so as part of this, we've developed a set of charts that have been manually validated as being compliant by a compliance officer. And so now, kind of knowing, having a human review of what is compliant, we can actually now find anomalies compared to that set of validated compliant charts. So that includes, for example, non-compliant charts where key sections are very underdocumented relative to what they should have been. But also, kind of like you were mentioning earlier, we can also find charts where there's a lot of over documentation happening, where, hey, someone's writing a book for the history of present illness or including 30 goals, which we've seen. And so we can help provide those insights back to the therapists, to kind of the compliance officers, practice leadership, clinic directors. So rather than them having to do the work of trying to figure out what's going on in my practice, we can kind of give them the insights and allow kind of the effort to be put into improving.
Very neat.
So
Daniel, how does this impact strategic decision-making for PT companies now?
Every company is different, but I think we would all be able to agree that from a transparency standpoint, we've never seen something like this. So, we could objectively now compare details that we've just never had available to us, where you may have an area that is problematic or an area of weakness for a certain provider. Maybe they're not collecting, outcome data on progress notes, or maybe they're missing information on, maybe they're really poor on Medicare low back patients, right? So now we're able to like drill in and not just see a cherry pick chart, which in your experience and my experience, probably anyone who's done what I've done, you love those cherry pick notes because it's just one snapshot in time. And then you're like, okay, I think you're good for the year. And the answer is, no, that's not the reality. I think also another big area that people are going to be looking at this and saying, okay, this is groundbreaking, is definitely in due diligence. It's definitely underserved, in my opinion, when I've been speaking to these types of conversations with different businesses, is always legal and accounting, right? When someone says due diligence, they don't really think documentation. But having that insight, having that meaningful information for the associated risks absolutely impacts the future of any kind of financial deal. So now you could see really how strong different therapists are and how you can compare with visual analytics, which before you couldn't extract that. That wasn't a KPI. It wasn't very tangible to you to use. Again, so now it's literally apples to oranges, because you were in the past doing what you could afford to do, which is 3 charts, 5 charts, whatever it is, and now you have every single note available to you.
Yeah. So then, Robbie, does it matter what EMR I'm using to utilize Prediction Health?
So right now, we're supporting a variety of common EHR systems out there in the physical therapy space, and we're also planning to add more. So please kind of reach out to us, and we can work with folks to get them set up.
Cool. So Robbie, as someone who developed a technological solution for compliance in physical therapy documentation, what other big learnings have you discovered during this process?
So that's an interesting question. So we started, with a focus on like measuring the compliance audit scores with our AI. That was kind of the initial goal, to process the charts to help kind of provide that visibility. But as we started processing documentation and developing dashboards, we saw there was a lot of variability in care. And we saw that there's a significant benefit in having the ability to visualize those kinds of practice patterns and have visibility into practice performance overall. And so, we know that, as clinicians, we know that, hey, there's variability in care. There's been research showing that, but then seeing it visually represented in dashboards where you can zoom in and zoom out on certain patient cohorts, certain providers, and different subgroups really helps highlight kind of what the opportunities for improvement are. And, actually, Kelly, you were telling me a story yesterday about, a therapist being able to like look at one of our dashboards and immediately kind of pointing out, here's a couple therapists that, have some non-optimal, documentation and coding habits, but very easily kind of being able to see where there's variability, where there's inappropriate variability, and then kind of figuring out kind of what are the steps that we can do, kind of what's the why is there that inappropriate variability, and how can we work to address it. So it's kind of been exciting to work with clients on those dashboards to help kind of provide and build out more visibility in kind of clinical practice excellence or operational and financial efficiency as well.
Yeah, very cool. So then, Daniel, this is a big question. I've never been audited before. So why do we need to be concerned about this now?
That's a terrible question.
It's a question we hear a lot, right? I've never been audited.
It's so common.
Why no?
It's true. Everyone wants to say that. They always ask. You know what? I actually asked this question last week also to a presenter at a compliance conference, and they laughed at me because it was, well, do you really expect to get a return on investment? Because that's not your goal in auditing. I hear that. I hear the logic. I trust me, I do. But reviews, audits, investigations, or any other name a third party calls it, the likelihood that you're going to receive a letter in the mail asking for additional documentation to support the billed services is a very good bet. And we know this because the OIG, Office of Inspector General, as well as CMS, just announced it again. These routine programs were actually placed on pause during COVID, but they're back with a vengeance. Just a really quick example, right? So let's say you open a post-payment review letter in the mail, and it says they determined 15% of the claims are found to be insufficiently documented, so you got to make a repayment. Okay, no big deal. It's just a few $100s. Okay, hold on. So what the investigator isn't saying to you in the letter is that error rate will trigger future audits if it's above a certain threshold, right? And extrapolation is a terrible sampling penalty that says, well, if you had an error rate above 20% or something, we will now apply that rate to all claims paid over X period of time. And the penalty number just jumped dramatically higher. So, I mean, there are strategies for communicating with these reviewers to prevent closed case errors like that. So don't just roll over, obviously, if you open the mail today. And, a final thought on this, I mean, the amount of time and energy and resources necessary to manage an investigation for or false claims reporting versus simply having a prevention focused like risk management compliance program is smart and a very sensible decision. Like it only takes one costly mistake from a compliance perspective. But if you've implemented like a meaningful, strategies in order to demonstrate that you have like just not exposed yourself to either being reckless or negligent operations. That's the game plan that everyone should be taking.
Mhm. Awesome, thank you. So thank you, Ravi. Thank you, Daniel. Great information. I want to make sure that we can leave some time for questions at the end here. So we'll go ahead and address those now.
Awesome. Thank you, Kelly. Thank you, Daniel. Thank you, Ravi. That was chock full of some awesome information. I do have a couple of questions here. So the first one is for Daniel. And this is referencing the APTA standards that you had mentioned at the beginning of the webinar. And the question is, in terms of maintaining those standards, how are those enforced, especially if you are not a member?
That's a good question. First of all, I would love to speak to anyone that's not a member. It's good for the profession. It's good for the industry. They do a great amount of, I'm not here to advocate to, write a check to your local chapter, but it's good for the profession. If, we're licensed in this profession, we need to advocate. So just putting that out there. So in terms of enforcement, there isn't enforcement in terms of penalty, direct penalty. However, if your state chapter, if your licensing board finds that you are not complying with those established rules, and typically the language is mirror image of each other. So most state chapters mirror the image of the APTA. So, and they have the enforcement, they could take away your license, they could penalize you, on and on. So that's where we actually see the enforcement.
Awesome, thank you so much. So the next question is for Ravi. And the question is, what kind of deliverables or action items should I expect from the Prediction Health compliance dashboards?
Yeah, great question. So with our dashboards, we're able to have those updating on an ongoing basis where we can flag for, say, a therapist what their areas of weakness are, their specific areas of weakness. For example, with documentation compliance, we can track perhaps they're struggling with documenting their goals of care. And so kind of with our therapist report card, we can actually flag that as an opportunity for improvement and then provide, kind of work with you to provide kind of the educational guidance to show how they can improve, kind of provide that to the therapist and then track their score on that metric over time to confirm that they are improving. And so we're able to provide that information to, say, the clinic director, but also directly to the therapist. And then that's where kind of having the expertise of Kelly and Daniel is really helpful, since they've been involved in the past in having those conversations with therapists to help them improve. And so have the expertise of figuring out how do we actually help our therapists be the best that they can. And so Kelly, Daniel, if you have any other ideas, feel free to chime in.
Yeah, I think that's a great, I think the biggest thing to emphasize on the deliverables is the information that you're getting in a dashboard for the leadership, and then the scorecards specifically for the therapists. And so there's information both on the leadership level that's more operational and larger picture, and then on an individual level, you have the information that's necessary for the therapist to be better. And like Ravi said, Daniel and I have experience with how to make behavior changes. And that's something that we help with this. That was years and years of my life, was trying to get therapists on board with things. So.
Yeah, real quick, just to add to what Kelly just said, I think being on the receiving end, you have that level of appreciation that you don't want to drown out the noise. You don't want to overburden somebody with too much information also. Mm-hmm. So it has to be concise, it has to be meaningful, but it has to be impactful as well. So we know that if you're taking something, this type of information, and delivering it in a way that is saying, hey, by the way, we're going to make you a better therapist. And how do we do that? By showing you X, Y, and Z. That's really powerful.
Yeah, definitely. Thank you, guys. So I have one more question from the Prediction Health chat, and this is not addressed to anyone in particular, so feel free to jump in, whoever wants to take this one. The question is compliance all legal, or will it also help my bottom line?
I'll take that first. Yeah. So it's definitely not all legal. I'm not an attorney. I don't play one on TV. I think the bottom line is that you want to protect the company's assets and limit liability. and limit exposure. So this is just one component of a larger picture in compliance, but it's a critical component because it's ongoing. It doesn't end. And the ability to demonstrate that you're doing something that is meaningful is very hard to do in this space because, you know, the 70,000 plus charts that I've reviewed, having that feedback, you still can't ever scale enough. And that was part of the challenge. Everyone was limited by the same barrier, right? But this is something where all of a sudden we kind of have an advantage that we've never had before, which is very unique.
Do you have anything to add to that, Robbie, before I go?
No, fire away.
Okay, so yeah, thank you for that question. I think that that's something like, when we think about compliance, we usually think about it from a legal standpoint, but I always think like the reason compliance exists is to actually make sure that we're providing great care. And there's all the other reasons around it too, but when we can actually show our therapists and be very certain, because we're analyzing all the documentation, that they are providing great care, then they become better therapists. And my philosophy is great care is not just what you're doing with your patients, it's how you're billing, it's promoting physical therapy. So I'll jump on that soapbox too, Daniel, right? Being part of the APTA, being an advocate for PT. And there's so many ways that's needed to be done, from every interaction with our patient, every documentation that we do, every billing cycle that we do, every, conversation like this that we're having, like in every fiber of what we're doing as PTs, it's important to make sure that we're doing that to become better therapists. But we don't have enough information most of the time to actually know if we're doing that. And so, yes, it's so much more than just a legal thing. It can actually improve your revenue because it should be improving you as a therapist as well. And so, I can wax poetic about that all day long, but for time's sake, I will wrap that up. So, I do believe we are at the end of our time now. So I wanted to thank everyone again, Robbie, Daniel, thank you so much for being here to have a conversation with me. And then also thank you for everyone for joining. This was a fantastic conversation. This is all of our information here. If you have any questions, please don't hesitate to reach out. This was such a great, robust conversation. We do plan to have more webinars discussing compliance issues and other things around the PT realm in the future. So we hope to see you there and have you join us in the future. So thank you all for joining. Take care.